afternoon and thanks for joining us. I'm Judy Simpson. One of the best tools in the fight against cancer is education. Over the past 20 years, education, along with research and screening, has helped dramatically increase the number of people who survive cancer. And education is why the University of Vermont Cancer Center offers its annual Women's Health and Breast Cancer Conference. This year's conference is Friday, October 2nd. It is the 18th consecutive year that UVM has hosted the event. It is free and open to the public. And today we're going to get a preview. Joining me are co-chairs of the October 2nd conference. Dr. Patty O'Brien is a UVM Cancer Center member. She specializes in lymphedema and the long-term medical needs of cancer survivors. And Dr. Allison Bolduc is a UVM professor emeritus in the Department of Family Medicine. Dr. Bolduc is also the former president of the Vermont Academy of Family Physicians. I want to welcome both of you. Now, the conference is expanding this year, but Patty, talk a little bit about what the conference has traditionally been about and why the change.
Well, in the past, we've really focused on breast cancer because that's the biggest group of survivors out there, and really mostly a women's disease. But we realized that there's a lot of women with other types of cancer, ovarian cancer, renal cancer, any organ in your body can unfortunately get cancer. And we really wanted to reach out to these other women and make the cancer for all women with cancer at any stage in their disease, because the types of information you need are really pretty similar. I mean, as soon as cancer is attached to your body, you have a lot of needs. And so we're trying to reach out to all women with cancer. We still continue to get partial funding from the Susan G. Komen Vermont, New Hampshire Foundation, and they're supporting the breast cancer part of it, but we've had very generous support and donations from other groups so that we can reach out to these other cancers.
And also, too, we're talking about a lot of people because you're not only talking about cancer survivors, but you're talking about their family members and even friends.
Right. Cancer touches many people's lives, and there's over 40,000 survivors in Vermont alone. So each of those 40,000 people has a whole group of people who loves them, who is concerned about them, and it touches all of their lives.
And so this year, though, another focus is the role of primary care in cancer. Why is that?
So that we can really start getting our patients back to their primary care provider after treatment for their cancer or during treatment.
So, primary care is usually the access point for many folks. We develop long-term relationships with our patients, and we are usually the folks who help to diagnose the cancer in the first place, and then have them consult with our oncology colleagues. So with that long-term relationship, we really have formed a bond that is very crucial in their ongoing care. And they may have many other diseases as well as breast cancer.
Now we're looking at a graphic here, and that sort of exemplifies what you're talking about.
Yeah, it's the shared model of care with the patient at the center. So the patient would come into a primary care office, and then we would work with the oncologist or oncologist colleagues to help with the treatment of their breast cancer or other cancers.
Is the thinking, too, that the patients have gone through this really life-threatening situation many times with their cancer, and so they figure once they've beaten the cancer, that's it?
Right. Wrong. Yeah. Unfortunately. No, a lot of people are like, oh boy, I did that one. Yahoo, it's behind me. But they don't stay up on all their preventative health things like, you still got to get screened for your colon cancer, and you still got to keep your immunizations up to date. And the side effects of your cancer treatment may have actually put you at increased risk for other diseases. So taking care of a cancer survivor is actually pretty complex because they've got all their primary care needs, and now they've got this new set of needs. And there's a new tool that's been developed called a survivorship document that patients should ask for at the end of their acute cancer care. They should say, okay, I want my survivorship document to navigate me back to my primary care doc. And that's going to give a summary of these are all the drugs that you got. This is exactly what type of surgery you had. These are the long-term side effects of this treatment. And it is a nice summary for the primary care doc to then pick up and say, okay, we're going to need to do an EKG, an electrocardiogram at these intervals. It just is a tool for that handoff.
It's like a personal owner's manual, kind of.
Exactly, exactly. And it guides the patient to understand their responsibility and their side effects. And it guides the primary care physician who's going to be getting, survivors of all different cancers. So, the oncologist treats breast cancer, and they're really top on that. But the primary care doc's going to get lots of cancers. And so they're going to really need these documents to guide all of these follow-up tests.
And are patients pretty good about following up with their primary care?
Well,
people?
certainly during the cancer treatment, probably not. Again, they formed a really, really close bond with the cancer center and with their oncologists and their team. And so very often we don't see them during that time. But once they are finished with that treatment, we generally do see them back in our clinic. Again, I think this document will really be very, very helpful going forward because it's something new and different, and that transition of care will be very helpful in their ongoing treatment.
So what are some of the tools to facilitate these kinds of discussions between physicians? Patty?
So this survivor document is now something that is a mandate. So it's been a recommendation for years, but it's now, if you're going to be a cancer center, you're going to have a mechanism to create these documents and get them back. So our cancer center has been working very hard to create a survivorship specialist. And she then creates these documents and goes over them with the patient and then gets them to the primary care physician. So it is a new tool. It's a piece of paper, but it's got everything in one place.
Well, that must be really critical because, I would imagine going through, weeks, months, even years of cancer treatment to keep track of everything that you've gone through. To say, I think I had this, and where's the paper? Where did I write that down?
Go ahead.
Correct. It really is helpful for us as well, just in that ongoing discussion about what screenings need to happen and where we need to go from here, just for their, again, ongoing care.
You mentioned it briefly, but maybe we could talk a little bit more about some of the examples of the health risks that cancer survivors face.
Yeah, it amazes me. People will come in with something called lymphedema, which is a swelling in their extremity that they got because lymph nodes were taken out and they got radiation therapy. And I'll ask them, so tell me about your surgery. And people are like, well, they took part of my breast off, but they have no idea how many lymph nodes were removed. And they're like, well, yeah, I went to radiation therapy, but they don't really know what part of their body was exposed. And so this document helps them know exactly what the treatment was, but in there it lists you are at risk for lymphedema. We know that there's a real relationship between blood sugar control and recurrent cancers. So, if you kind of sat around on the couch a lot during your, your cancer treatment and gained some weight and, your blood sugars may have gotten out of control. You got to get that diabetes under control. And, so you're at increased risk for heart disease from a lot of the drugs that you may have gotten. So you were told this before you got those drugs, but you were so busy worrying about the cancer, you don't remember that you were told that. And so this kind of puts it back in front of your mind and says, okay, you got to work with your primary care doc to get all of your risk factors for heart disease under control.
What should patients be asking their oncology specialists and primary care doctors if they're hearing this and they're concerned about their overall health after cancer and cancer treatment? And what can people do to sort of mitigate the effects of the treatment?
Well, I think one of the things certainly is to get out and exercise again and really work hard on their diet as well. and there are dietitians that can help with that, but also they can get that with the community health teams that are now available throughout the different offices throughout the state. Screening is really important for all of the reasons that we do that for everyone, not just cancer survivors. So colon cancer screening is still an issue. Keeping their blood sugar, as Patty said, under control is still an issue. Monitoring for heart complications is really an issue. And so all of those things need to be, and people need to ask about those and be involved in their care as we work together, for their health.
Well, it's interesting because, people will be, if you're a parent, you're all about that for your children.
Right. Yeah.
But for yourself, you don't necessarily think about it.
Well, that's true.
Yeah.
Right.
So we've highlighted the fact that you're focusing on primary care as an audience this year. But what specific goals do you have in mind, or what impact do you hope that this is going to have?
Well, we hope to reach out to physicians throughout the state and the physician teams to really help them to understand that there is this tool available now, that we're really working hard on that transition of care back to the primary care, that we get the education that they need. We hope to bring them in so that they, to the conference, so that we have some lectures on various different kinds of cancers. But again, it's really more about education and to help them in any way we can to support them in that transition back to them for the cancer survivors.
Well, I think the education is a big key to that, and just to give people, the responsibility of taking care of their own health, because it's a huge responsibility. And I think in the past maybe people have been sort of intimidated or not wanting to go to the doctor, but it's really critical, especially if you've had one of these events in your life.
Yeah,
absolutely.
And so what else do you want people to know about the upcoming breast cancer conference?
Well, we really want to reach underserved areas, so somebody may come to a cancer center, get all this cancer care, but then go back to a more rural community. And so we're really trying to educate everybody in that rural community as to how to support people. We're really trying to get information, again, about all cancers, so whether it's skin cancer or colon cancer or rectal cancer, bladder cancer, any type of cancer, we want you there at this conference. We welcome you, and we want to have things to support you.
What kind of feedback are you getting? Are you hearing from these sort of rural pockets?
We're hearing a lot from women with other types of cancer who are saying, yeah, thank you. Thank you for acknowledging I too had cancer. I mean, I think that it's really hard for these people who don't have the popular cancer to feel like they're included, welcomed, supported, all these things that really help you get better. And education, give you the tools so that you're not afraid of your disease and your symptoms.
Now, in past years, about how many people have you had come to these conferences?
Usually about 800. 800 seems to be sort of where we're at. I'd love to get over that. I want to hit 1,000, but we'll see.
So what are some of the topics that people will hear about?
There's 80 topics, so you got all day here. So we're trying to have a session on all the types of cancer. So, there will be a small lung cancer group. There will be a small rectal and colon cancer group. There will be multiple sessions on cardiac disease for physicians and for patients. So we're educating a very, very diverse audience, so we have to have very diverse topics. And we educate people in large groups with PowerPoints and sort of big topics, but also in small groups called coffee chats. So however you learn, there's a place there for you.
And once again, it's the 18th Annual Women's Health and Cancer Conference. It is October 2nd, free, open to the public, survivors, providers at all levels, and you can register online, or you can call the number that is, the website is on the screen, and the number is 802-656-2176. I want to thank you so much for joining me today.
Great, thank you.
It's very important information.
Yeah.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.